Welcome everyone. We, the Embassy of Israel, alongside Bridge India, are delighted to have you here, joining us for what promises to be a fascinating talk. My name is Vivian Eisen, and I am Director of Public Diplomacy in the Embassy of Israel in the UK. I would like to kick off the event by sharing some information about Israeli-Indian relations. Full diplomatic relations between the two countries were established in 1992. At the time, our volume of trade stood at $200 million. Just 28 years later, our volume of trade stands at over $4 billion per year. The India-Israel relationship stretches across many different fields and includes not only bilateral trade, but also scientific and technological collaboration, tourism, agriculture, culture, and military and strategic ties. Moreover, Israel and India are in the process of negotiating a free trade agreement, which is expected to triple trade between the two countries. Needless to say, our relationship is clearly going from strength to strength. Today, we'll be learning about the two countries' cooperation in the fight against COVID-19. This topic is also extremely relevant to the UK. The past week, we witnessed a lot of controversy around the numbers of testing, the length of time for the results, and the high cost here in the UK. We'll be hearing from Ambassador Ron Malka, Ambassador of Israel to India, and Lieutenant Colonel Yaniv Meirman, Research and Development Lead from the Ministry of Defense in Israel. Sanjay Suri, who is the political editor for Europe in Network 18 Group, will be our moderator for the event. I would like to hand the floor over to him. Sanjay, please.
Thank you very much for the very kind introductions. And of course, you're absolutely right to say that this is a huge problem, whether it's Britain, Israel, India, anywhere in the world. In fact, who can remember the last time there was a global problem that affected every single person on the globe? I don't think that happened even in the Second World War. Anyway, here we are seeing a problem that is common everywhere. We've been seeing the number of cases rise in India to a very high level. Israel has gone into its second lockdown now. So a common problem, but what is unique and remarkable is Israel and India are also looking for solutions in common. And we are very privileged to have Ambassador Malka with us here. If you would tell us, sir, what is it that Israel and India are doing together here?
Well, the collaboration between Israel and India, especially in the scientific and technological areas, has been going on for a long time. Since the outbreak of the pandemic, our prime minister, which are very good friends, had some conversations, and they decided, like always, to cooperate, to work together, to share practices and experience. So we started with that, sharing all our best practices, the experience that we got just in learning and from trial and errors of trying to manage this pandemic. In the beginning, it was very hard to understand exactly the environment, but since we work together and we share together, we enjoy the experience of each one, like we always do. Since we realized from the first beginning, I think India and Israel realized from the first beginning that we need to take strict measures to fight the pandemic and to flatten the infection curve. We did it together, and of course, again, we shared the practices and the experience. We decided to work together, first on trying to find vaccine. You know, Israel and India, 2 out of 5 nations that reached the moon. So you can imagine that the collaboration of the spectrum of collaboration, science and technology is endless. So we decided to work together first on trying to find vaccine or antibodies, but then we realized that it will take time until we'll manage to immune all the population with a safe and effective vaccine. So until then, we need to find solutions that will enable us to somehow balance between, from one hand, the attempt to avoid infection as much as we can, but from the other hand, to allow the economy to function and to go on. So to balance between life and livelihood. So our bright scientists from both sides, from the Ministers of Defense and with the principal scientific advisor for Prime Minister Modi, which are working together for for a long time, decided to focus on tests for COVID-19 because we realized that if we'll have this ability, this capability, it will change dramatically the way that we live under this pandemic. So we tested many technologies, tens of them, and of course there were some requirements. I'm sure that Colonel Yaniv, which is an expert for this research, will elaborate more about the details. But we tested tens of technologies. Only 4 of them got to the last stage. We started tests in Israel, and we continued the tests here in India. We understand the relative advantage of each and every one of us. So together, we just use all these advantages. We managed to take 20,000 samples within 9 days. I think it's a world record. It's a very fast research. And this is most thanks to the scientists from both sides that really harnessed whatever they could do just to make this operation successful as it was. And now we're just waiting for the analysis of these samples. And hopefully, if we find even one of these 4 technologies that was tested that will be reliable enough, valid enough, it will be a game changer.
Thank you very much, sir. And we, of course, hear you loud and clear, and so do all who are joining us, and which means that your voice is carrying to us. And that is interesting because one of the tests has been to determine positive or negative coronavirus status from the voice. And Commander Yaniv, you've been in India and you've been spearheading that part of the trial. This is fascinating. It sounds fascinating. What is it that you're looking for in the voice, and how are you looking? That can tell.
Okay, first I will tell you how did we gather the samples. Okay, in the voice we took about 10,000 samples of different people, meaning that we had recordings of 10,000 people saying a few vowels and actually quoting some sentences. And our idea is to record it in very high bandwidth, the sound recording, and look for unseen changes in the voice, things that you will not be even aware of. Just repeating these tests and using an app on your iPhone or Android cellular mobile device, and you will repeatedly test yourself. And of course, the system will online learn your changes and then can actually flag that something is wrong with you and you need to go be tested for any, respiratory illness. But then now we are focusing and we're doing it jointly with the Defense Research Organization in India, the DRDO, which is also part of MOD. And we're doing it together, all this using big AI, machine learning, and we're talking about really big data. Talking about 10,000 analog, each recording for a few minutes. It's a lot, huge amount of data. And to my understanding and what we have looked, there is no such database. And if I can elaborate a bit more, the MOD, which usually deals with defense procurement and defense R&D, actually at the beginning of the pandemic, the head of my organization, which is in charge of defense R&D, decided to look on dual-use applications, look at technologies that are usually used by the defense sector, and see how can we leverage them, how can we use these technologies in order to help both countries fight this pandemic. And when we did all the conversation with the Secretary of the DRDO and the Principal Scientific Advisor, we wanted to focus on screening tests. Okay, we had dozens of technologies, but we want to look at the things that can help restart the economy. Open the skies, it was named the Open Skies because this is our objective, to enable flights, to enable people to go between places, restart the economy. People can return to the place of employment. This was our aim. And one of the technologies is using these voice recordings in order to detect minute changes in your voice that even the most skilled person will not be able to distinguish by himself.
And when will we have the results for this?
Okay, so this is a $1 billion question, $1 billion question, because it takes time. Unfortunately, when we're dealing with R&D, there's also risks, and not all technologies we may succeed, but as Ambassador Ron Malka mentioned, even a single success will help us a lot. We're now in the position or process of analyzing all this information and working very closely. When I say closely, I mean daily meetings with DRDO, which is the Defense Research Organization, and we're working on it. I don't have any big announcements for now, but we are working on it very hard.
Thank you very much, Commander Yaniv. Your Excellency, given how much Israel and India are working together, depending on what solution is found in common and when it is found, is there an agreement also to share it between the two countries on a priority basis?
Your Excellency, you are muted.
Am I now? I'm sorry. Well, as I mentioned before, on this specific research, Israel and India are partners. So, of course, we are conducting all of this together. Everything is coordinated, and whatever will come out from this research belongs to India and Israel. And we'll work according to the relative advantage of each and every one of us. For example, we understand that India has a relative advantage in manufacturing. So, of course, if once we get to this stage and we are working, started planning it now, before we have the results, just to save time, we understand where it's going to be, because, the manufacturing capability of India is, remarkable. So, of course, we work together, we share together. It's a cooperation between Israel and India. So we are partners in that. So, of course, we start with Israel and India. But as we always do, and this vision is, I think, is similar to Israel and India, we share it. We are also going to share all our achievements with the whole world. So, of course, we start with Israel and India, work together, produce together, but then, of course, share it with the world. This is the way that we conduct our data. This is the way that Israel is been doing for many, many years. All our technology developments and achievements, we share with the world, because we really believe that this will make the world a better place, more friendly, more cooperative, and that's what we are looking for. Please.
Please, sir. Please continue.
Add to that the collaboration between Israel and India is not only about this research. So this research is really exciting imagination, and hopefully once we get one or even maybe a combination of these technologies that will give us the results that we are looking for, as we said, it will change dramatically the way that we do. But then we are not waiting for that. Israel, a startup nation, we developed many medical equipments that are used especially for fighting COVID-19, using cutting-edge technologies. Many of them was found very, very useful. So when we came, and I had the honor to come on this plane with the delegation of scientists, our vice scientists, we also brought with us all the medical equipment that was developed in Israel and was found useful and efficient, and we shared it with our friends here in India. We gave it to Ames Hospital, which is now integrating it to his system, and once it will be found useful, we are going to share it on to spread it all over India. And from what I hear now, they are very satisfied. It's very effective. They found it very, very useful. So this is something that we personally went with the specialists, the experts from our Ministry of Health to our leading hospital, Sheba in Tel Aviv. We collected all the device equipment that was found useful, according to the head of the Corona department, the COVID-19 department in Sheba Hospital. Some of the equipment was contributed by the companies that love so much India. Some of that was purchased by a special fund that we got from our Minister of Foreign Affairs, Mr. Gabi Ashkenazi. And we bought all this equipment, and it's now here in Delhi, in Ames Hospital, implemented, integrated, and once they will get used to it, we are going to spread it all over and to save as much lives as we can. What we also brought in this airplane, a very advanced Tier 1 respirators. And what is special about that is these respirators are export banned in Israel. But still, we got a special exempt for India, a precious friend. And this is the right time to thank again India for being such a good friend, for helping so much Israel just in the beginning of this crisis, the outbreak of the pandemic. We needed to evacuate thousands of Israelis that were stranded all over India under full lockdown and closed skies. And we managed, with the assistance of all the authorities in India, we managed to evacuate them, all of them, to Israel safely under these conditions. It could have not happened without the special assistance that we got from the Ministry of Civil Aviation, for all the states, the governments of the states, the police, and all the other organizations that were there. When Israel needed medicine and raw materials for medicine, protecting gears, India provided them. Even there was, a scarcity of that, they provided them to Israel, and that's how friends do. It's our friendship values. So now, of course, it's very obvious and natural for us to share with India all our technologies and medical equipment that was found useful to fight the COVID-19 together.
Sir, as we know, the population size of Israel and India are slightly different. In India, of course, the challenge is to scale things up. What do you find through your experience of India's ability to scale up technology and to reach it to a lot of people and in good time?
Well, it's remarkable. I think this is part of the successful relations that are there in India, because we share our technology with our counterparts here in India. We work together, but to upscale, up leverage, we can do only in India, and it works so well. Israel and India, not only that they are not competing each other, they are completing each other. Think of Israel, a small country, usually full employed, not under this pandemic, but usually full employed, with many achievements and new achievements and advanced technologies in cybersecurity, medical, and many other sectors, coming to its precious friend India with lots of trust and respect, work together, develop together, and manufacture for India and for the world. This is Prime Minister Modi's vision. This is our vision. It matches so well, and we're just completing each other. And I think this is the explanation for the remarkable successful of this partnership and collaboration between Israel and India in many sectors, many aspects. And now it's spreading and widening more and more. Even now, under this pandemic, we are ongoing with many, many initiatives, working together. Just 2 weeks ago, we signed an MOU, a flagship project on water management with the state of Uttar Pradesh. So we're going to bring the Israeli water management model as a holistic model to Bundelkhand in UP. This was signed just 2 weeks ago. Next week, I'm going to sign another MOU in innovation with IQA, an incubator in Gujarat that is working together with Israel on solutions for COVID-19 and other challenges that are there. So we are advancing even under the pandemic. We are taking the initiatives forward, because when something is so successful, you want to have more and more of it. So even after this pandemic, Israel and India will be even closer friends. We know it for sure, even by now.
Nothing like a crisis to bring good people together. But of course, with all the new technologies and all the new agreements that you described, scaling up in India will be a unique challenge in every particular area. And talking of scaling up, in COVID, certainly what India would need very much is simple tests that can be done and even at home and deliver very quick results. And Commander Yaniv, many of your trials are also looking at other kind of testing, a saliva test, a breath test. Can you tell us a little more about those experiments and what those are and where we are by way of trials and expecting results?
Well, maybe some technological, but maybe I can start answering it as Commander Yaniv when he joins us again. He will. So, as I said, there are 4 technologies that we got at the stage. And of course, as you said, one of them is just take the saliva and trying different technologies. So one of them is just a high frequency test. So we take the sample, and we just project a high frequency terahertz frequency, which is very high, and try to, so to speak, find the fingerprint of the COVID-19. It really excites the imagination to think that we take out of physics sector something that we implement as a biological test. So this is one of them. The other technology, the third technology, because you mentioned technology, I now just talked about the high frequency. The third technology is thermal technology, some temperature manipulation that we do on the sample, and again, enable us to see and to find, to detect the, so to speak, fingerprint of COVID-19. It's really exciting. And the fourth is polyamino tests, just to try to find the molecules, the protein molecules of COVID-19, which are related to COVID-19. And again, a fingerprint of COVID-19, which we can detect within 30, 40, 50 seconds. And this will what will make the change. What is also important to say about these technologies, that they are made locally, the tested are locally, which makes them very cheap, very fast and very cheap. So we can upscale that and produce it and just spread it whenever we need. So as Commander Yaniv said, we named this operation Open Skies because the first thing we do is just open the sky. Think of every airport that you can just test everyone that is getting in within 30 or 40 seconds to know if it's positive or negative for COVID-19. So you can just, think of conferences, events that we are now avoiding for making. It will change everything. So this is what excites. And as I said, only one technology will be enough, or maybe a combination of more than one of these four technologies that will give us the valid results that we are looking for. Will be a game changer. Please, Commander Yaniv is there with us. So
yes, Commander Yaniv, good to see you again. His Excellency has very kindly briefed us about some of the other experiments that you have trialed in India. Could you share with us your experiences of these trials and give us some estimate when again we could expect some results to emerge?
Okay, first of all, I apologize. We can try to fight the COVID, but power outage is something we cannot fight, apparently. But we recuperated for that. Secondly, we are looking at a few technologies, and all these technologies are for different aspects and different approach. As I mentioned in the beginning, our main objective is to find screening. Okay, so we have four technologies for screening. One, we talked about the voice recordings. The second, we're talking about two technologies which are very fast recognition. One is using a breathalyzer, is using spectrography. We already are deep into the analysis of this information. I believe in a few more weeks, we can actually share some of the initial results. And they look promising, but still I'm doing it very carefully. I'm saying it with caution because, as you know, with R&D, you can see the initial results, but if you have a gap or any risk we cannot deliver for this. This is why I'm talking very carefully. And the second one, which is the polyamino, is again, a very quick test, swabbing a bit of saliva under your tongue and give you a very high rate of sensitivity for negative people, meaning we'll be able to screen. If you go and get tested before you board the plane, after 1 minute, you'll say 95%, for example, that you are not infectious and you are healthy. This is screening. This will enable us to open and restart it. And another technology, which is actually it's very similar to PCR but different approach, is called RT-LAMP. Is using some saliva at first at a point of care that you will come give a small saliva swab, and they will check it. It will take maybe 20, 25 minutes. And later on, we can, using India's advantages for production, using India's scientists to work with us on it, we can have a kit that you can test yourself at home. And before leaving the house, you know if you are safe and you will not infect anyone else. And you can go to work feeling confident that the pandemic is under control. And of course, if you are found positive, you can go to the nearest hospital.
Meanwhile, we have a question, sir, from Madhav Turumela in London, and he has a concern about protection of privacy. some of this data gathering could compromise personal privacy. Are there factors built into the testing, or are there regulations in place that will respect privacy?
First of all, we had a lot of conversation with our Indian partners, the DRDO, regarding privacy. And one of the things that was most important for us, that we will not be aware of the true identity of each sample. So actually each person who was tested, who was sampled, we got a unique ID. That person, we didn't know where he lived. We don't know his name. We don't know anything about him that is violating his privacy. The only thing we know is that we have a sample and we need to test it. Of course, by regulation, our Indian partners, they know exactly how to do this matching between the sample ID and the person. And they are keeping that with them. This is one of the first things that we discussed, how to protect privacy and how to do not violate the people's rights for being private. And of course, not gathering information. So this is very much addressed in all tests.
Thank you, Commander Yaniv. We have another question now, and perhaps Your Excellency, you might wish to share your views on this. The question is, I'll read this out from Neil Lal. He's Chairman and President of the Indian Council of Scotland. He says, we must continue this great friendship in not only fighting COVID, but also continue in the economic trade and investment. I, as Chairman and President of the Indian Council of Scotland, invite the Ambassador Ron Malka and Bridge India to Scotland in celebration of the Israeli-India and Jewish partnership. So good wishes and an invitation, sir.
Thank you so much. Is there any question that I should answer? Thank you for the invitation, but is there any question related to this? Because
this is he wants to know if how wide this area of cooperation is between India and Israel. You already touched on some aspects of that, but how it goes beyond the fight against COVID into other areas that are economic and looking into the future as well.
Well, I think that now this cooperation between Israel and India goes for every sector that you can think about. Every sector that you can think about. So, as I said, it started with security, but now we are talking about food security and water security. And we went from education to innovation. And of course, all kinds of aspects of livelihood, of living. So, as I said, now we just signed an MOU on water management, which is going to bring the holistic approach of Israel. A mutual project between Israel and India on agriculture is the best that we have in the world. We have now 29 functioning centers of excellence of agriculture all over India. Just last year, 147,000 farmers were trained in these centers of excellence. In 1 year, 147,000 farmers. So of course, so it's water, it's agriculture, it's food, technology, all kinds of technology, innovation. We are working together. It's cyber security. As I said, in education, we have exchange of students, and this is the thing that we are doing on the level of government to government, but also business to business. So many Israeli companies are working together alongside Israel, Indian companies, and it's very successful collaboration. And also in the level of people to people, we just, obviously what we do is trying to connect right people. And once we achieve and we really get this spark that we are looking for, this chemistry that is so there between Israel and India, it works so well. And I mentioned before, science and technology, even the space is not the limit. You used to say that the sky is the limit, but even the space is not the limit, because we also collaborate in issues that are related to space. And as I said before, 2 out of 5 nations that reach the moon are Israel and India. So it's an endless scope of collaboration. Every sector, every aspect of life, we are there. And as I said, it's so successful, so good, so fruitful. So we want to have more and more of it. For example, we are now going to nominate this year for the first time the water attaché in the embassy of Israel in India. We decided that the partnership between Israel and India on water, it's going to be a strategic partnership. So we are going to nominate alongside a company, the agriculture attaché that is already here for many years. We're going to just nominate a water attaché. And together, they are going to bring to India our holistic approach for water and agriculture. So every aspect that you can think about, we are there working, collaborating, just, emerging Israeli companies, Israeli individuals with Indians counterparts, and it works very, very well.
How far, sir, is the friendship at a personal level between the two prime ministers accelerating all this?
Well, of course, it helps so much. When there's such chemistry between two great leaders, and giving all the other ingredients that are there, the mutual trust and the mutual respect that is there between the people, of course it helps. It really pushes and gives us the energies and, of course, respect on the environment that we need just to advance. But then, having said that, the stage that the relations are now, it looks that it's going to stay forever, irrespectively of what will be the political developments. It's not something about individuals, not about parties, it's between people to people. So this is where we are now. So many connections, so many levels, and so fruitful and so rewarding, as if just we found our soul and we are working together. So I think it's going to stay, of course, the friendship between the prime ministers helps so much and gives the energy that is needed. But now, as we advance and reaching new heights, I think that it's not about individuals or parties anymore. It's about two peoples that enjoy so much to work together, to collaborate. The chemistry is great. And there is love and affection. Love and affection. Whenever you just enter a room, when there are Israelis, Indians working together, you see how the joy that is there, the love, the affection, the chemistry that is there. So what else do we need?
Well, what else do we need? What we do need now is a vaccine, and Israel is working on one. India is working on more than one. Certainly, Israel is also working on more than one. And Commander Yaniv, you pointed to very promising paths and promising trials. What's happening with the vaccine development?
So actually, vaccine was not in the scope of the cooperation between our countries, besides sharing of information. And I think Ministry of Health on both sides are sharing information regarding the progress in the vaccine. Israel is now supposed to start in a few weeks, the first phase of clinical trials for vaccine. But again, when we had this conversation already in April with India regarding how to look at this endeavor of fighting the COVID-19, we wanted to look at things, not that will give you the final answer, it will be long-term, like vaccine, it may take 6 months or a year or even more. We wanted to give high-risk, high-value technologies that will be able to screen a lot of people in masses. Because now, for example, in Israel, we are going for a quarantine, a lockdown, and India is also in some kind of lockdown depending on the country and depending on the state. So we talked about doing mass technology, which will be fast and much more effective economically for mass testing. Okay, if the test now for COVID, for example, costs about 3,000 rupees, okay, per test, or 2,500 rupees per test, and we are talking about doing tests that will cost us, I don't know, 200 rupees. So again, we can mass produce it, and this is one of India's greatest advantages is the opportunity, the ability to scale it up, to mass produce it and spread it all around India and also for the world itself. Israel, although it has its production capabilities, we are not built for this kind of scale, okay?
Yes, and certainly Israel is not accustomed to attempting contact tracing on India's scale. That, of course, given the scale and the spread, and needless to say, the uncertainty of the spread, is a whole mammoth exercise in India. are there any strategies, however different the scales may be, when Israel has some experience in this and India has experience that is also being shared, strategies, methods?
Yes,
Yes.
please, Ron.
Of course. As I said before, we share everything we have, the practices, the experience, we share the achievements and the mistakes that we did. For example, we can say now that after the first wave, we released eases the restrictions too fast. So of course, this is something that we just shared very fast with our precious friend here in India. So to avoid these mistakes. So not only the achievements, we share everything, whenever we find something that is useful, is relevant, is important, we share it, we work together. We also consult each other about the practices that we do, whatever we try, and we found a successful, or as I said, whatever we are trying to avoid of making. So the cooperation is ongoing, the exchange of know-hows, of experience, of practices, best practices, is something that we do on daily basis. Commander Yaniv can tell you that with this joint research on rapid tests, they're talking every day. So it's there, always connected, always sharing, always thinking together, analyzing together. So it's something that is ongoing, it continuously, and this is what is so effective in helping each other, supporting each other.
Your Excellency, you spoke of some medical regimes that have been put in place in India in some hospitals, and these use Israeli know-how or know-how developed jointly between Israel and India and doctors and scientists from the two countries. How effective have these been in preventing deaths, in speeding up cure, treatment, and recovery? Because the recovery rate in India is quite good. How far are these technologies contributing to that?
Well, in many aspects. First, as you said, it was found very useful. And I can tell you how, because now in Ames Hospital, as I said, it's not something that just for one stage, it's continuously. So now we understand that they ask for more equipment from what we've brought, and we understand which equipment works better and which is not. And what they're telling us is something that we assume from the beginning, that this medical equipment will also be used after the pandemic, because what it basically does, which is the biggest challenge that we are now facing, trying to treat the COVID-19 patients, is how to minimize the exposure of the medical staff to the patient. So most of the medical equipment that we brought, using cutting-edge technologies, artificial intelligence, big data analysis, and all these advanced technologies, just to enable the staff not only to monitor from remote, but also to treat from remote. One of these equipment is a robot, medical robot, that a doctor can use from remote just to send it to the patient with medicine prescriptions, tell all the bios of the patient, just have a conversation with him, examine, diagnose him from distance. This is something that needs very, very much. I know it, or even before the pandemic, I just went, since we came, and maybe this is something else that I wanted to say to the question that was there before about the collaboration, trying to understand what are the challenges of India and to see how we can add any value to that. So one of the first things that I did was to meet Dr. Indu Bhushan, which is the head of Ayushman Bharat mission, which is, I think, the biggest healthcare reform that is going to be in the world. It's going to be conducted here in India. And one of the first things that we talked about is how to enable Indian medical staff to monitor and to treat from a distance, because there are many distant villages and settlements in India with no medical support. So we can enable, like we do in Israel, a remote treatment, not only monitoring, but remote treatment. And these are the devices, the medical equipment that is now there used in this, in Ames Hospital. And from what I hear from this doctor, this is something that they are going to use even after the pandemic, and will first minimize the exposure of the medical staff to the patients, and will enable to treat those that are in distant places with no medical infrastructure and support, just from 1,000 kilometers, I think so. it excites the imagination. So of course, it's very useful and will be even more useful after this. It's not only for fighting COVID-19, it will advance the whole healthcare system and the support that is given here in India.
Most reassuring to hear, sir, that this is in there for the long haul and across a wide spectrum. But clearly quite amazing things have happened through this experiment. Commander Yaniv, we were speaking about a trial, I think, did you say 20,000 tests, and you carried this out in 9 days, and you said that's a world record. Quite safely, you are correct. We've seen other trials being conducted around the world by companies from various countries. Some have been more in the public eye than others. But a challenge has been to test on scale. How did you manage that many tests that fast?
First of all, I would like to say that no shortcuts were made. We adhere to every regulation regarding privacy, regarding getting the approvals from all the regulatory authorities in India. And of course, this includes informed consent signing from each patient, and each subject had to be briefed regarding the test that will be held, and they need to approve. And we had some people that in the middle of the process say, we do not want to take part of it, and it's very legitimate, and we just said, okay, thank you for participating, you can go on. Besides that, we saw the spirit of volunteering from the Indian people all around. Actually, the way we did it is we had a setup of 6 sampling areas, each like a production line, which is very, very Indian-like. We had a big production line that we did mass sampling of, indeed, each day we did about 1,000 divided by 6, about 150 to between 150 to 200 people per site. And we did it in hospitals in India, and people who wanted to get tested came, they volunteered, they got informed consent, and we did it around the clock. So we started very early in the morning, finished late at the evening, once people stopped coming, and prepare, do some debrief, and the next day trying to improve. So actually the first day was the slowest day, but we improved each day until we got 25,000 tests. Okay, this is not 25,000 people because we're talking about 4 technologies, but let's say above 10,000 people, different people who were tested in these technologies. Okay, so we took the samples, some of which we analyzed in our hubs that we set up. Again, this could not have been done without the true trust that we have between us and between the DRDO and the MOD, and without the full cooperation for every regulatory ministry in India, starting from the Ministry of Foreign Affairs and through the MOD and Ministry of Health and Family Welfare. Everyone chipped in, everyone got involved, everyone pushed as much as they could to do it, and we did it in record time, as I mentioned. I don't know any incident such as this, including in Israel itself. We didn't reach these masses. Even if we try to scale it, we're not in these numbers. So it was a big effort from everyone. It was very successful.
Yes, I mean, it sounds amazing. Your Excellency, you've been describing the wide spectrum of areas in which Israel and India are now cooperating. But looking into the future, we also know that a free trade agreement is under negotiation. We've heard from your colleague that trade went up from $200 million a year to over $4 billion in just a very short time, and that what is hoped and anticipated is that it will rise 3 times that number very soon. When we're talking of a free trade agreement, what is it that could then be traded between the 2 countries on scale and quicker that is not currently being done? What will this enable?
Well, I think that every economics will tell you that free trade agreement is something that advances the economies. It really enables us to use the relative advantage of each other. So this is something that is very wanted, very needed. And having said that India and Israel are not competing each other, but completing each other, it will only contribute to each and every one of us. So we are working on that. I'm very optimistic that it will be there. It will be successful. And again, it will support the whole, I think, effort that is there, and the process that is there of enhancing and widening and deepening the relations, the commercial relations and all other cultural and other relations that we are now developing. I think that free trade agreement is a crucial part of developing of this kind of strong and close relations between countries, especially when we are talking about the countries that are completing each other. This is something that is really natural to have. So we're working on that intensively, and hopefully in the coming future, we'll have this, this agreement.
Well, we have a question, Your Excellency, from Stephen Darby. I'll read that out to you. Will India's poor that live in rural districts where infrastructure is sometimes lacking have access to kits and treatment?
What is, I didn't get the question. What was the question? Like
the question, sir, is that a lot of poor people in India live in villages.
Yes.
And their access to hospitals and to the kind of innovative treatment that you described is quite limited. Are you aware of moves to reach this kind of promising treatment to poor people who live in villages?
Yes, yes, this is exactly what I talked about. So this is going to be a crucial part of Ayushman Bharat mission. So a remote treatment, because this mission is meant to get to each and every citizen in India. So in order to get to those that are in distant places without the right infrastructure and medical equipment, this kind of equipment, I can even show you. I have here with me one thing that we shared with Ames Hospital. This is an Israeli medical equipment, very advanced one, using cutting-edge technologies that enables a doctor to treat, not only to monitor, but also some kinds of treatments of patients from 1,000 kilometers. To put this in a village, in the center of a village, just training one nurse to know how to use it will enable doctors to diagnose and to send prescriptions with medicine to those distant places with this small equipment that is using artificial intelligence, the connectivity, of course, of the net with digital file and digital data that is provided to the doctors from hundreds and thousands kilometers. It can really treat the patient and give him the right diagnosis. And again, using the big data analysis that we have, the millions and tens of millions of other cases that are there, analyzed, and it will be very efficient. It's already done in Israel. It's used in Israel, was found very successful. And if you put this kind of device in each and every distant village and just train the people, 2 or 3 nurses just to use it, people will get a treatment of an expert of the best doctors that are there in Delhi, in other places that can treat from distance. So this is the vision. And this is something that is really, we can really implement it very, very fast, working on that. And this will be the future of medical treatment. It will get to the most distant village in India with no infrastructure, just with this small device.
That is very reassuring to hear, sir. And
if I can add,
yes.
If I can add something regarding the rural areas of India, I think one of the things for diagnostics is that we do not need a lab. This is the big change. We don't need a sophisticated PCR test. We don't need anything. Very simple equipment that can be mobilized or in a car that can go between villages and do mass testing of people and give them on-the-spot results regarding their health condition if we're talking about the COVID. So you can do it very fast and you don't need a big infrastructure. You just need a car, few gloves, few swabs, and a simple machine.
Thank you very much.
May I add that in Israel, it's also done with two-wheelers. We have this special staff that are getting with two-wheelers, so they can get to any place, very fast on two-wheeler and bring this equipment and give the treatment. The doctor is distant from there, with the connectivity, using all the data analysis that is there. So yes, even two-wheelers.
Well asked, Stephen, because these responses have been most informative and reassuring. Very final question of the afternoon, sir. If I may put it to you, Your Excellency, as you said, that this is a relationship beyond a personal relationship between any two leaders, wonderful and welcoming as that may be. It's between people, and it's here to stay. But in this relationship, as a basis, what does it mean to Israel and Israelis as people to have the awareness that India is one of few countries historically that has always welcomed and been friendly with Jewish people? Is that a factor? Talking of friendship between people, is that a factor you consider?
Of course, it is a factor, but I'm not sure what is the cause and what is the reason. Because, of course, for Israelis, Jews Israelis, to know that there has never been anti-Semitism in India. Always just good relations, love and affections between the peoples. And this is something that now, for me, being in India for almost 2 years, is now so obvious and so clear, because when I see the similarity in, I'd say, the emotional structure, the family values, the friendship values, the way that we hug, that we kiss, that we love, that we show affection, that we express our emotions, not in COVID-19, not with social distancing, but in regular times. So many similarities. So of course, I think this is the cause. This is what made the friendship, historical friendship there. No, never in the history there was any hostility between Indians and Jews. But this is something that is very deep. So the fact is that there is chemistry, many similarities in our heritage history, such great ancient civilizations, two ancient civilizations with many similarities, ethics, everything that we do, the way that we live, the way that we approach to life is so similar, so many connections are there, which explains the chemistry, the love, the affection, which evolved to now the best foundations of our relations, which are mutual trust and mutual respect. That is what we have between Israel and India now. Mutual trust and mutual respect. These are the best foundations for everything that we want to build. And since it's there, we know that it will stay forever.
So the chemistry in the labs or the COVID tests, the chemistry between people all points to a very promising future. Thank you very much, Your Excellency. Thank you very much, Commander Yaniv, for finding time for us, for finding the time for us here in Bridge India, and for sharing your thoughts with us. Thank you very much once again.
Thank you so much. Thank you.
It was a pleasure.
Thank you.